Have you ever experienced chronic pain, severe pain, or needed sedation for a procedure?
Discover fentanyl!
I was prescribed fentanyl because of my chronic pain from my cancer. I just used this transdermal patch to help with my chronic pain.
Fentanyl transdermal patches, brand name Duragesic, comes in doses from 12 micrograms to 200 micrograms per hour, and you can apply a new one every 72 hours. Be sure to remove the old fentanyl patch before applying the new one, and make sure not to cut the patch or expose it to heat. Any unused patches should be flushed down the toilet, and make sure to keep it out of reach of any children because deaths have occurred when toddlers have gotten a hold of it and chewed on fentanyl patches. If the Duragesic patches stop working effectively to control your pain, I can prescribe you Fentora, buccal fentanyl lozenges you place between the gums and the inner lining of your mouth cheek and let it dissolve, or Etic, buccal fentanyl lozenges on a stick. We would begin with the lowest dose of 200 micrograms and adjust as needed. You must wait at least 4 hours before taking another, and you should take no more than 4 in one day. Be sure to avoid any grapefruit and do not drink alcohol while you have fentanyl in your system. I just got hit by a car. I'm in severe pain. They said they're going to give me an intramuscular injection to help.
During your hospital stay, if you report moderate to severe acute pain, the nurse will administer a shot into your muscle of 50 micrograms per dose of fentanyl citrate to begin with. We will adjust the dose based on your response to it, and we can go up to 100 micrograms per dose if the 50 micrograms does not deliver adequate acute pain relief. I'm going in for colonoscopy and need to be sedated. They're going to give me an IV bolus to make sure I'm sedated throughout my procedure.
For procedural sedation, we will be administering 50 to 100 micrograms per milliliter fentanyl citrate through your IV as a bolus infusion prior to your procedure, and we will adjust the dose as needed in response to your level of sedation throughout the procedure. Fentanyl is an opioid analgesic that binds to opioid receptors in the CNS, altering the response and perception of pain.
You should contact your provider if your pain does not go away or if you experience any of the following side effects: blurred vision, double vision, dry eyes, pinpoint pupils, confusion, dizziness, depression, dysphoria, euphoria, sensation of floating, hallucinations, hyperactivity, nightmares, restlessness, uncontrollable bodily movements, apnea, bronchospasm, laryngospasm, respiratory depression, arrhythmia, hypotension, tachycardia, bradycardia, constipation, dry mouth, nausea, vomiting, urinary retention, chills, flushing, sweating, shivering, or muscular rigidity.
With fentanyl, my pain has decreased so much.
Fentanyl is contraindicated in patients with a known drug allergy, ankle glaucoma, bone marrow depression, pre-existing CNS depression, severe liver or cardiac disease, and known or suspected QT prolongation. Caution and dosing should be used with older, debilitated, or severely ill patients. Extreme caution should be used in cases of respiratory insufficiency, conditions involving elevated intracranial pressure such as severe head injury, and in patients with severe hepatic disease, intestinal obstruction, undiagnosed abdominal pain, adrenal insufficiency, hypothyroidism, cardiac disease, seizures, morbid obesity, sleep apnea, myasthenia gravis, heart failure, bradycardia, hypokalemia, or hypomagnesemia. This medication should not be taken by those who are pregnant or are planning to become pregnant without first talking to your doctor. In the use of transdermal patches, the FDA has restricted the use of transdermal patches to management of chronic or cancer pain in opioid-tolerant patients. This route is not to be used for acute pain relief such as postoperative pain or in opioid-naive patients. Co-administration of this medication with alcohol, antihistamines, barbiturates, benzodiazepines, phenothiazine, and other central nervous system depressants can result in additive respiratory depressant effects. The FDA has placed a black box warning on this medication due to the risk of combined use of other opioids and benzodiazepines. This combination should only be used if no other alternatives are available. Combination use can cause extreme sleepiness, respiratory depression, coma, and death. There is also a black box warning for the risk for misuse and abuse that can lead to addiction and death. If you or a loved one becomes addicted to this medication, help is available 24/7 by calling 1-844-289-0879.
With fentanyl, I got my life back.
Thank you, fentanyl!